All right, so there is the reality about medication. As much as I have to agree that medication indeed has brought through breakthroughs when it comes to managing illnesses. However, there's another side of the story that is often not being talked about. Okay, more than half of all prescription drugs cause adverse effects. Okay, you're not talking about like 20%, it's more than half. And they're not detected until FDA approves them, and sometimes many years later. So you may be thinking, okay, why is there such a huge gap? Okay, I think I've shared about metformin before this, all right, about how it causes cancer, and now it's being recalled. So it shows that this statement is correct. So what are the holes in this pre-approval process? Okay, number one, all right, it's too small. Okay, a lot of these clinical tests done, they recruit maybe up to 3,000 people, okay, for one trial. Okay, and it's too short. All right, they mostly do it in under a few months. All right, and it's definitely not representative of the long term. And everything is done under controlled conditions. That means that you may not be able to achieve the same result if you were to translate that to real life. So these three are major reasons why a lot of medication may not really give us the effect that we want. Right? And a lot of all these research are very carefully designed to only give us the positive result. Right? The negative result or negative finding are oftentimes not reported. Okay, there are no way they're going to publish a journal to talk about how this medication failed. Right? Definitely there is P&C, so you only see the good side of the picture. And now, of course, all right, with the emergency and the kind of viral rates is going on around us, that's why everywhere is being pressured. Okay, government is pressuring drug companies to produce medication faster. So these are all factors that contribute, right, to the side effect of medication that many people are not aware of. So let's take a look at the top 10 medication, all right, that is prescribed around the world. So the first is the top 5. So number 1 is what? Hypertension, right? Hypertension, all right, high cholesterol, diabetes, hypertension. The next 5, right, it is still hypertension, more hypertension, okay, and okay, less is the list is respiratory. So as we can see here, really, 60%, all right, of all these drugs prescribed are all metabolic related disorder. Easily, all right, out of 10, you can see a lot of hypertension, there's diabetes and high cholesterol. And 50% are all heart-related issues. Okay, this speaks a lot. Means a lot of the medication that people are taking now are due to causes that can be prevented. And medication is not cheap, and most people take medication for the long term. So you can just imagine how much money have the population donated, right, to the pharmaceutical industry. So no wonder, right, they are the leading industry in the world, worth so much more than any other industry that we think of. So there is a dire need, all right? There's really a need to solve this problem. If medication is not giving us any issues, then there's nothing we can say about it. But there's another side of medication that many people do not know. And is it really solving illnesses or really making them worse? So how can we strengthen the heart? This is a very important question that we will be revisiting today. So CoQ10, all right, it's a very popular enzyme, okay? It is actually an enzyme, it's cofactor enzyme. So for those who have attended my enzyme session, then you will understand in depth, okay, what does it do. So CoQ10 is a very specific enzyme for energy, right? So all body cells needs energy, okay, not just the heart, literally every single cell. And if you do not have enough CoQ10, is going to affect 95% of the energy that's being produced in our cells. All right, this is a very big percentage here. So that's why all of us need CoQ10. So the heart, okay, it's not the only organ that needs it. All right, there are several organs in the body that do need high amount of CoQ10 because of the level of energy that they use. So next is liver, immune system. Right? Many people will not know, oh, but actually your cells use a lot of energy to fight against bacteria and viruses. Okay, thirdly, kidney and your master cell. Right? Of course, for the benefit of today's session, okay, we will focus more on the heart-related aspect. Okay, so our heart, on average, pumps 60 to 100 times a minute. So this is range. So the lesser you are at this range, it means the healthier you are. For those who always do physical activity, okay, especially endurance exercise, their heart is a lot more efficient in pumping. So they don't have to pump that many times, all right, to get the blood flowing. So this one, okay, the lower you are on this range, the better. But another thing about the heart, you need to pay attention. Okay, you just need a slight trigger. A slight trigger can then increase your heart rate. So for example, okay, if you're just having a good time, suddenly you see a surprising email, all right, or an urgent email. Well, how do you feel? Immediately your heart will start pumping very quickly, right? You start to feel the heat. Okay, or if you hear somebody quarreling, siblings fight or whatever, okay, all these things is considered a stress response. And the first thing that reacts in our body is the heart. Okay? If you're angry, you can literally feel your heart pumping out from your chest. So at moments like this, okay, our heart can pump up to 150 times. Okay, just so you know, this is actually a big figure, right? Some people think, okay, 50 is nothing. Okay, one day if your heart pump extra 50 times, okay, that's just per minute, all right? And for calculation's sake, we're just gonna stick to this. But if 1 month, okay, what is the burden it does to our heart? In 1 year, just so you know, your credit card interest is not the only thing that will compound over time, right? Things like your heart, right? How stress will cause a long-term compounding effect to your body is tremendous. Okay, so it's no wonder, all right, people can die out of stress. It's really because of this reason. Okay, so because of this, okay, let's go into the blood vessel first. So I'm going to talk about hypertension. So for those who don't know, hypertension is generally high blood pressure. So what does this mean? Okay, high blood pressure happens when your heart pumps too fast. Okay, causes a pressure to exert on the blood vessel wall. So that's how they measure your blood pressure. So when that happens over time, definitely you increase your blood pressure, right? So this will long-term damage your blood vessel. So your blood vessel will be very stiff. Okay, there'll be wounds in your vessel, and when your blood vessel become damaged and pressure increase, it will also damage the heart muscle, right? It's like a circuit, right? It goes, what comes around goes around. And this can become a vicious cycle that can be very, very harmful, not just only to your blood vessel, but also to your heart. So do you see the link here? Okay, so just so you know, you can still get a blocked artery even with normal bad cholesterol levels. Surprising, right? I'm sure a lot of you don't even know about this. Okay, why is it? Because whenever our artery there's a wound, there's a gap. So whenever there's a gap, everybody has cholesterol, all right? So the cholesterol is going to be stuck there, and eventually it will build up into a plaque. So this can happen to anyone really, and especially if you have high blood pressure. And what is the healthy level? Okay, healthy level is 120 to 90. So, okay, let's push the limits a bit. So if we just increase 10 digits, all right, for example, 130, 80, right? Most people would think that, oh, this is not a problem, you know, this happens with aging, so on and so forth. Okay, however, by just merely increasing 10 digits, okay, it's seen in 69% of people who have their first heart attack, in 77% of people who have their first stroke. Okay, and it's also seen in 74% of people who have heart failure. And just to give you a bit more context, as long as you have 130/80, okay, there is a possibility of you getting all these things. All right, all these conditions happen when a person has this decreased figure. So, because of this reason, right, the American Heart Association has tightened their guidelines. The last time 130 and 80, right, you can just, you know, manageable. But now because of all these risks, they say they even recommend, if possible, straight away go for hypertension medication. Okay, it's that bad. So hypertension is not a small issue. It's actually quite serious. Right? It happens, okay, because, okay, sorry. Just to show you, this is how normal blood flow looks like. And it's possible because there's this thing called nitric oxide. It ensures our blood vessel relax. Okay, but when free radical comes in the picture, okay, it destroys this nitric oxide. So what happens? Your blood flow immediately will be restricted. Okay, immediately will constrict. So of course, your pressure will increase. So this is so easy to happen, right? Hypertension is so easy to happen, and it does not matter whether you're healthy or not, you're eating salad or you're exercising everything or not. Okay, because everybody, okay, lifetime risk of getting hypertension is as much as 90%. It doesn't matter you're healthy or not. The risk is this high, you know? So, okay. Okay, so let's see about how CoQ10 can really help to manage this issue. So, CoQ10 will cancel out the negative effect of free radical. So when that happens, nitric oxide is available. So when this is available, our blood vessel can relax. And secondly, CoQ10 will also react directly to the blood vessel. So, voila, right? The restricted blood vessel will then become normal again. So this is how CoQ10 can help in managing blood pressure. Right? For those of you who don't, I hope this can help you. So CoQ10, all right, can first of all reduce the damage of free radical. Okay, and it can help to dilate and relax the blood vessel. Okay, it also helps to decrease salt retention. So with all these factors combined, this is how CoQ10 can help to collectively reduce our blood pressure. Okay, so after we talk about the blood vessel, of course, we have to talk about the heart. So this is how the heart looks like, normal heart. Okay, this is what that can happen over time. So some of you may not really see much of the difference because within these two, it's simply just this getting a bit bigger, right? But this section that gets bigger is because, all right, if you pay attention to the muscle, this muscle is thick. This muscle is very thin. So it means that the muscle has wasted away and it has become weakened. So blood cannot be effectively pumped out from the ventricle. And when that happens, that is where heart failure occurs. right? It's a condition that causes muscle in the heart wall to slowly weaken and lose its ability to pump blood. So what does CoQ10 do in this picture? So CoQ10, okay, is found to be a lot lesser in individuals who have heart condition. It doesn't matter, is it a heart attack or cardiovascular disease or whatever. Okay, many research find that these patients have a reduced amount of CoQ10. Okay, and because of that, they have high free radical and their blood vessel and heart has also become a lot weaker. So CoQ10 is found to be crucial, okay, for energy production, especially in the heart muscle. So what does the evidence tell us? Okay, CoQ10 can reduce the risk of heart failure hospitalization. Well, first of all, nobody wants to go there. And secondly, it can also reduce the risk of heart complication. When taken within 72 hours after heart attack, all right, for a year, it will reduce the risk of another repeated heart attack. So especially for individuals who have heart attack before, many times doctor will recommend you must take CoQ10, because if you have one-time heart attack, you can have it the second time as well. So CoQ10 can really help to reduce this risk. Okay, and significant cardiovascular death risk is reduced in a study with CoQ10 using for 4 years. Okay, another study showed that CoQ10 increases HDL and reduces the risk of artery blockage. So current evidence and the strong safety profile of CoQ10 makes it highly recommended to be taken in. So there's really a good amount of evidence that shows CoQ10 is indeed protective for heart, for your blood vessel, and for also your heart. Okay, so just now we talked in detail. All right, one of the top 3 medication is actually statin. So just so you know, cholesterol and CoQ10 production in the body uses the same pathway. So because of this reason, okay, statin inhibits cholesterol production. So this also means that CoQ10 will be inhibited. So there is a good reason why, okay, for those who are on statin, a lot of people will recommend them to eat CoQ10, right? Because it does affect, okay, and it may lower the level of CoQ10 up to 40%. 40%, you know, this effect can be very harmful. So those with statin must consume CoQ10, right? It's not encouraged. You have to take it, right? Because it inhibits and it will affect your heart in a bad way. So in summary, okay, how does CoQ10 help us? All right. First of all, we see clearly on how it can help to reduce blood pressure and give us strong heart. Next, okay, I want to talk about CoQ10 and diabetes. All right, a lot of people, they may not even think about it because CoQ10 is mostly always a heart-related issue. So surprisingly, there is actually a relationship between CoQ10 and diabetes. Okay, so when our cells produce energy, at the very same time, it will also produce free radical. Okay, whether you like it or not, our body will produce free radical. So when that happens, it can harm the pancreas. Okay, it harms all the cells in the body, especially the pancreas. And this makes the cell to be less sensitive to insulin, and sugar level will be high. All right, and when that happens, okay, basically the cells will be stressed, and many studies showed that normal cell and it's a lot less stressful compared to diabetes cell. And because of this reason, many studies, okay, have showed that individuals with diabetes have a much reduced level of CoQ10 in their body. All right, so let's see how it helps. Okay, so if a person have reduced CoQ10 levels in the body, it can actually lead to increased HbA1c level. Right? Who would have thought? Okay, why? It's because when individuals have diabetes, their body cannot convert ubiquinol to ubiquinol effectively. All right, I'll be explaining this process more in detail, but basically, ubiquinol is the predominant form that our body uses. So whatever ubiquinol we have, eventually it has to be converted to ubiquinol. So when this is affected, our cells will lose the ability to fight against free radical. This is pretty serious. So a normal individual, 94% of ubiquinol will be circulating in their body. But for an individual who have diabetes, they only have 24% of ubiquinol in their body. If you ask me, I think this is a huge difference. Okay, and no wonder people are starting to relate diabetes with lack of CoQ10. Right, so there's a lot of experimentation done, okay, clinical trials to see how it can help. So CoQ10 at 200 milligram per day. Okay, 200 milligram is actually considered quite high. So they've done it for 12 weeks. They see that it has significantly decreased HbA1c here among patients with diabetes and cholesterol. And there's also significant decrease, okay, in HbA1c in the CoQ10 group. This is a separate study. All right, and another study also indicates that there is a significant increase in insulin production. So our body can also be more sensitive to insulin, hence it can bring down the sugar level in our body as well. So I think this is a pretty strong statement. Okay, and also CoQ10 can help to break down fats better. Okay, can help to prevent things like diabetes, obesity. So we can see there's a link, right, of how CoQ10 can prevent metabolic disease, right, from your blood vessel, your heart, and even to your sugar level. It's got something to do with CoQ10. All right, so I get this question a lot. Okay, a lot of people say, yeah, it's true that our body do produce CoQ10, but how does it differ according to age? Now, if we look at this figure, we can see very clearly, all right, for those when you're a teenager, before 19 years old, okay, your body will produce a lot of CoQ10. But once you hit 21 years old, the CoQ10 level actually declines pretty significantly. And of course, when you come to your middle age, right, 43, then it declines even more, until age of 81. So the misconception is here. A lot of people think that you will only lose your CoQ10 when you're in your 40s, which is true. But they miss out this part, all right? If you see the steepness of this graph is a lot more drastic here. So CoQ10 actually declines after 21 years. So I think, all right, this is what is really going on. So people will be wondering, okay, if that's the case and if CoQ10 is so important, how can I then increase my CoQ10 intake? So let's look at a few food options. So all the meat, all right, that people are talking about, okay, about how it can help to give us CoQ10, only have 2.6 milligram, Goodness, okay, 2.6, that's beef lah. Then fish is 2.3, and chicken breast is only 1.3 milligrams. And maybe there's other better sources. But, okay, peanut and egg, oh my goodness, is 0.1. It's so close to 0, if you ask me. It's like, so little. And CoQ10, 14 to 32% of it is further reduced during cooking process. So for example, if you eat egg, if you eat beef, I think by the time everything reduced, there's literally no CoQ10 there anymore, all right? And CoQ10 amount is going to be significantly lower for those who have low vitamin B. So this is the reason why I talked so much about chlorospirulina and replenishing nutrients in the previous session, okay, because it will affect the other vitamins in your body, and especially CoQ10. And for those who have metabolic disease, you can see very clearly that they will also have decreased CoQ10 and of course statin use. So if food intake is so low, what can we do to overcome this issue? So I'm very glad to share with you the newly upgraded CoQ10, right? It's now available in Malaysia, Express, and Singapore. So what is so different about this new formulation? So we have changed the old one, okay, which is ubiquinone, and we have upgraded it into ubiquinone, right? And per serving, there's 60 milligrams of ubiquinone. So for those of you who know about the Thailand formula, okay, we are actually using that, okay, upgrading and changing all our CoQ10 into that formula. So you can get your CoQ10 here, all right? So this is the million-dollar question. What is the difference between ubiquinol and ubiquinone? So between 80 to 95% of body circulating CoQ10 is in ubiquinol form, right? Which means 95% is a lot, okay? Right? And ubiquinone has to be converted to ubiquinol to completely show its function. So if this process is not done correctly, you may have things like diabetes. Okay, and also ubiquinol is 3 to 4 times better absorbed compared to ubiquinone. And doses of ubiquinol is lower than ubiquinone, okay, because it is more absorbable to the body. So this answers the question, you know, people say previously, okay, it's 100 milligram of ubiquinone. But the 60 milligram of ubiquinol we have, actually, if you look at it, the effects is way better than the previous one. Okay, the absorption of CoQ10 is increased if taken food because it's fat soluble. So it's best taken after lunch. Okay, dinner, afraid later you cannot sleep. So after a big meal, it's good to eat. All right, before we close, there are a few benefits that I still want to share with you that I think is actually very useful. Okay, number one, look at this woman and her clear skin. Okay, looking at it makes me want to have this skin as well. So CoQ10 is by far the strongest fat-soluble antioxidant. And because of this very reason, it can reduce wrinkles and smoothen out skin. So next time if you post any picture on your Facebook, don't have to put a ton of filter already to make it, you know, you can just post it without any filter. Your skin will look like this lady over here, all right? And it gives you a youthful complexion, a more radiant glow, makes you younger, all right, and you feel good about yourself. And CoQ10 pairs very, very well with collagen. Okay, it just complements each other and it can help to boost, in fact, the absorption of CoQ10. Okay, last, this may come as a surprise for many people, but CoQ10 can actually affect fertility. Okay, because number one, stress negatively affects reproduction. Okay, I was just doing a bit of research on infertility. So stress really does have a huge effect, all right? It screws out our hormone production, all right? A lot of effects will happen because of this. So, and they also find that those who have infertility will also tend to have lower CoQ10. So this CoQ10 can actually energize the sperm and egg cell. And because of that, these cells become stronger, right? And they ovulate, like for example, for women, you will ovulate more on time, all right, the ovulation will be more complete. And for sperm, it will be more higher quality, all right, the shape will be more healthier, all right, and it can help to increase chance of pregnancy, right? There's actually quite a number of studies to talk about how CoQ10 can really help to enhance the health of these reproductive organs. So this is, I think, good news for everyone. Okay, so today we have studied very extensively about the wide range of effect CoQ10 does on our body, from our heart to our blood vessel, to sugar level, your skin, and even your reproductive organs. So just so you know, our body works hard 24/7, right? It works tirelessly every day just to keep us alive and breathing. But are we taking good care of it or not? So we only have one body, and this is the only organ that we have, so we have to take good care of it.